Birmingham OwnHealth was England's largest example of telephone health coaching. It was established in 2006 in a large city. And telephone health coaching has been used in many countries and is often operates in slightly different ways. In Birmingham, it was for people with a long-term condition such as diabetes, or cardiac condition, or COPD. And patients were given a dedicated nurse manager who they spoke to over the telephone once a month. And actually, they were working with the managers for a long period of time, often years. The idea was that patients might learn different self-care behaviours by working with the nurses and eventually improve their health and avoid unnecessary hospital admissions. Well, previous evaluations of Birmingham OwnHealth have found that it was associated with really quite high levels of patient satisfaction and also some improvements in clinical metrics of disease control, for example, body mass index amongst diabetic patients. But nobody else has really looked at the impact of Birmingham OwnHealth on hospital admissions in a controlled way. So in 2010, the Department of Health commissioned the Nuffield Trust and also Ernst & Young to do some analysis. By that point, the service had been operating for 4 years and 3,500 patients had already received Birmingham OwnHealth. So rather than conduct a prospective study, we looked back to see what the impact had been since 2006. Well, of the 3,500 patients, we managed to analyse 2,700 patients with a history of hospital use. And because we wanted a control group, we selected matched patients from other areas of England using national administrative hospital data. So it's quite good because we had some groups that were matched fairly well in terms of the variables we had data on, such as age and prior hospital use and healthcare diagnoses. And what we found out was that the intervention patients receiving Birmingham OwnHealth saw an increase in their hospitalisation rate from about 0.31 emergency admissions per head to 0.38 in the year after enrolment. In contrast, the matched control group saw a smaller increase in admissions. So it looks as though Birmingham OwnHealth was associated with a faster increase in emergency hospital admissions than usual care in other parts of the country. It's obviously disappointing. We hope that Birmingham OwnHealth would reduce hospital admissions as well as increase satisfaction and improve clinical control. The scheme has been decommissioned since. It was decommissioned last year, so it's already too late to try to incorporate some of the learning of the study to improve care in Birmingham OwnHealth. I suppose the question is whether other parts of the NHS should implement health coaching. And our study findings are actually quite similar to some of those coming out in another study. So, for example, there was a large Medicaid study published, I think it was earlier this year. Really, I think more thinking needs to be done about what are the elements that make up a successful hospital avoidance programme, as there are some successful elements out there. And possibly one of the largest lessons is to try to use some of the techniques that we implemented in this study, using matched controls and the administrative data on an ongoing basis to improve care and diagnose problems with services, rather than wait until the end and conduct a retrospective evaluation.